Hello, everyone. A very good evening and a very warm welcome to Facebook Live and YouTube Live channel of Continua Kids. Today, we have come up for all our dear parents with a very special guest. And why I am calling her special is because she is a mother to a child with autism, and her name is Ayesha Firdoz, and she is also a master's in clinical psychology. She's a cognitive behavior therapist, and she's working as a state head in Karnataka for a Green Pencil Foundation, also working as a clinical psychologist and a special educator with Sahara School for children with special needs. So we have this very special guest with us today who's a mother and also an educator, a psychologist, and let us see what we can learn from her experiences of how she coped up with the process of diagnosis to intervention and how she has managed her journey through bringing up or parenting her special child. Welcome, Aisha, to our channel today.
Thank you, Dr. Himani. It was great pleasure for me to joining in, and it's a great platform for me. Actually, I never thought that I'll become a speaker someday like this. So it's a very great moment for me as well.
Yeah. I think it's when mothers connect with other mothers, it's very motivating for our mothers who are coming listening to our channel, or parents who are following our channel, to hear your experience as a first hand experience and get motivated from you. That is our sole motto as to why we have you today as our special guest, so that you can motivate more and more parents with your
Exactly.
experiences.
That's my biggest aim. Whatever I've learned so far, that's to motivate other mothers. Exactly.
Yes, yes. So let us start with our session today. And so our first question would be, when did you first notice that your child's development is not age appropriate, or there's something of a concern when it comes to development of a child? And what kinds of signs and symptoms did you observe? And what age did you start observing them?
Okay. Since I was in abroad, we didn't. The environment over there was different. So we didn't had any socializing and all those things.
Yeah,
So when he was around 3, I noticed that he didn't like to play with others. There was no stranger anxiety. He would go to anybody in malls and everything. And there was no appropriate, speech development, or there was no walking, proper walking. There was no indications of, wanting of things or anything. He was still like, 1 year old, even though he was 3, not even 1 year, I can say 9 months old baby. When he
mm,
was 3 years old, he was behaving as if he was 9 months old baby. So it
right.
was too much pampering, even not to get down from arms, always
Mm,
want to be carried, kind of
mhm.
things. So we didn't knew whether he is going to walk, or that was the first sign
At 3 years
where,
also, your child was not walking. So
yes,
that
without
then
support. With support
without,
he would go, yeah.
yeah. So
Without
did you
support he
reach
never.
out to a neurologist or a specialist or a pediatrician who would tell you why the developmental milestones are delayed for your child?
Actually, when he was 6 months old, things started that he had nystagmus. So
Yeah,
we noticed nystagmus, and he has vision problems.
yeah.
So after that, it was always like maybe it is because of his vision, maybe it is because of his vision, maybe it is because of his vision. Till 3 years, it was continuously because of the same reason. We never thought it is something else.
So
So
you observe that globally the child is delayed in all developmental domains. And
yeah,
then when did you get a diagnosis as to why is this delay? And are there, but I believe there were some autistic symptoms also along with
mm,
global delay that you observed. So
yeah,
when did you get a
exactly.
final diagnosis as to what your child has?
that he was flapping hands when he was excited. He never knew what to do. He was flapping hands, and he was rotating toys. He was
Right.
going in a corner and sitting alone and playing toys. He
Mm,
never did anything like there was no social smile, there was no eye contact when we
mm,
wanted to see. But eye contact, we didn't focus more because we thought something related to eye problems.
yeah.
So that was something we neglected in the beginning. So after that, it was like for everything, it was delayed. Why is
Mm,
it happening like this? We are not getting we are not getting a proper answer to our question wherever we go. It's like
mm,
maybe something with wait till
mm,
he's 5. That is what the main sentence or the thing what we got.
mm,
Wait
mm,
till he's 5 years old. Maybe there is delay in his development. So wait
right.
till he's 5 years old. Even for vision,
Okay. So nobody asked you for thorough investigations or working up for the child to be able to make a clinical proper
no,
diagnosis as to
no,
what delay is for.
no.
Okay.
Wherever
Okay.
I went in search, even for my vision, for his vision problems, it was
Mm-hmm.
like give him time, wait
Mm-hmm.
till he's 5. That is the
Mm-hmm.
common sentence what I heard from everywhere, around
Professionals
4 5
also.
places.
Professionals also. Doctors also.
Yes, yes, yes,
Okay. So that is somewhere where you got misled or you were not led appropriately by a
yes.
professional also as to what has to be done. Is there an investigation available, or do we have a diagnosis proper, or if not, what could be the probable diagnosis for
Yes,
this? Okay. So
because
when
since I told from the starting, it was like from the time he started turning over or sitting or neck standing, from the time
Mhm,
they just take the initial diagnosis, those
mhm,
things were delayed. So, taking
mhm,
that
mhm,
into consideration, they said me, since these things are delayed, I asked for an explanation. So, the
mhm,
explanation what I got was, since these things are delayed, you give
mhm.
them time till he's 5.
But no
That was the
intervention,
answer.
therapy, or anything
No,
was advised
no,
to you that something can be
no,
done to just help him learn these milestones in a better way.
no, no.
Hmm. Okay. So, when did you first get to know that your child is having global developmental delay with autistic symptoms, and you need to go ahead and do something? What? How did you respond to that when you got to know the
Okay.
diagnosis?
The first signs or something that was noticed was by my husband.
Mm-hmm.
He was checking on and on for all those 10 signs which are mentioned in Google for autism.
Right.
So he
Right.
said, my son is having, see, he's having all these things. Let's go
Hmm.
and check once. That was his thing. So I was like,
Yeah.
no, it is because of his vision. I was in denial.
Hmm.
He said, no, we'll do it once. And then when we went, the the clinical psychologist who was asking us questions was, whatever they asked us, it was like, yes, 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 yes. And it was like, yeah, go. These are the symptoms
Hmm.
of autism. Your son is having autism.
Okay.
And that moment, it was like we didn't know how to react. We didn't know what is autism. And the
Hmm.
next question what I and my husband asked was, is it curable? Is there any medicine? Is there any kind of treatment? Or is it something that has to be operated? Or how is it? What is it?
Hmm.
So that
Yeah.
was
So I guess
something.
every parent, the moment they get a diagnosis, go into a phase of shock and why me and why my child or why, what is it? Autism. We have not heard about this. No one in our family has autism. How? What do we do about it? Why did it happen? All these questions pop into our mind. Is it something that I have done
Exactly.
wrong as a parent?
Exactly.
A lot of time parents end up blaming themselves. Okay, is it something wrong that I have done in my parenting process that my child has autism? But I think it is no one's fault. Still, even the medical professionals and the doctors, they do not have a cause for primary autism. Yes, there can be some
Exactly.
autistic symptoms in children with global developmental delay. We can do genetic tests, we can do a lot of investigations to rule out any metabolic cause or any neurological cause for that. The thorough detailed investigations can be done to find out if there is a cause. for these symptoms, is it a secondary kind of an autistic symptoms associated with a primary diagnosis, or it's a primarily autism spectrum disorder? So that is, I think, the onus is on the professionals to guide the parents on that area, to be able to make a proper diagnosis so that the parent is aware, because diagnosis helps us to give a prognosis to the parent,
Exactly.
how long we have to treat, how much time it will take, what will be the outcome, what kind of an intervention will help, how long the interventions are going to go. So for all that, I think, you, if parents are listening, you must ask all these questions to your doctors and professionals who are dealing with it, whom you come across. Just make a list of all the questions and go and ask the professionals or the doctor your question, so that you get a proper answer for it, or you get sent to a proper professional who's trained to answer, manage
Exactly.
these conditions. Okay. So, how now you got the diagnosis, you both kind of accepted that yes, it is autism, and now you explored all the possibilities of treatment. How did it change the way you looked at your child, or did you change your parenting style or parenting strategies once you got to know that my child is going to learn differently?
The moment I got to know that he's autistic, the whole the world or the kind of aims what I had, or uh, I saw my child as a different person. I was only thinking about what will happen to his future. Will he depend on us after us? Kind of questions were bombarding on the mind, like what about his studies, what about his marriage, what about his children, what about his generation, will this continue, what is going to happen, kind of things. Then after some time, it took 1 year for me to actually accept that he has autism. Till then I was just googling and understanding what is autism.
Yeah.
I didn't knew. I didn't get a proper counseling as such. K, what is autism? So I request the professionals who are handling these clinical psychologists, especially as soon as they tell the parents that their kids are having autism, kindly give them don't give them a shock like as we got. Give them a kind of counseling then and there. Give them 1 hour of counseling before telling them what is autism.
Yeah.
Give them
Yeah.
how they can treat, how what is
And I
happening.
talking about
Explain success stories to them, especially.
yes,
Not
yes,
like just going and bombarding and telling them that your son is having autism, and that's the exclamatory mark over there. Please
yeah.
continue with that and say, discuss about what is autism, how this famous people, Einstein and everybody else, experimenters or inventors have autism, and how they are unique in their own way. So that gives a positive sense for even parents, to accept it at some level, not like me going into 1 year into that zone of accepting it, and facing the world was very traumatic for me as a mother.
Yeah. Do you think that early diagnosis would have helped you a little more with helping your child in a better way? Because it took you started looking for things at 5 years, and then you got a diagnosis somewhere around 5 years of age, and then it came as a shock. It took you time to accept the diagnosis. For the parents who are reaching out much earlier, or who are concerned, who reach professionals, at times professionals also tend to miss the diagnosis, because generally
Exactly.
pediatricians के पास वैक्सीनेशंस के लिए जाते हैं, और वहाँ
Hmm.
पे बच्चा जो है वैक्सीनेशन करते हैं, and they just make a small check and send you back. But
Hmm.
I feel that if parent has any concern about development, you always reach out to your pediatrician. If you will ask them, they will definitely do a detailed milestone check. They'll look at the child for a little longer. And
Exactly.
also for the pediatricians now, everybody is trained to do a screening for children, and we across the country, every pediatrician is trained to perform screening tests, and they know what age those screening can be done. So you can always ask also, and raising awareness, talking about it to your friends, colleague, that did you get your child screened, did you get your child screened developmentally. I think those kinds of things can and actions can help us to screen and identify delays early. Do you think it would have helped you more
Yeah.
if you would have got the diagnosis earlier on?
Yeah, maybe much, much, much more better
Much,
if he
much
would have
more.
been diagnosed at the age of, before 3 or somewhere around 3. It would have changed a lot of things. Therapy is what we give. It would be more effective in the early stages. As they
Yeah,
grow, tantrums and, all kind of meltdowns will be more, and it will be difficult for them to, change their behaviors. So
yeah.
once they are in that 3 or 4 years, we can
Early years.
somehow try to control them, but once they have
Because
crossed the age of 5.
neuroplasticity is there. So for the parents to know that there is a lot of neuroplasticity, the brain is still developing those new connections. जितने भी brain के नए नए connections हैं वो form कर रहे हैं. If we bombard them with
Exactly.
intervention at that years of their lives, then their long term outcomes are much better, and they
Yeah.
tend to catch up in that phase where their brain
Zone.
is
Yeah.
still growing. Yeah, so early
Exactly.
diagnosis can be very helpful. Early intervention can be extremely helpful.
Yeah.
So, what are some of the programs once you accepted? What are the programs or the kind of support that you use to help your child develop further or help him with the therapies?
After 1 year, what I did was I went in and joined an NGO called Manna Disability Center, where I took my son for therapies. So one condition what I added was I'll be there with my son for therapies.
Mm-hmm.
So
Okay.
the purpose was just to know and understand what they are doing, and I can do it multiple times at home. So I was that eager to make my son strong. So then, when they got to know what I was talking about, they
Mm-hmm.
said, "We are going to do parents training program. If you are interested, join us." So they did a parents training for developmental disorders, wherein they took 1 month of training, and they gave us a practical exam as well. And they took us to therapy rooms and told us like take a one-to-one session, and that's where they selected me as a special educator, because I was
Okay.
able to handle within 1 month. I was able to learn things with the theory as well as with the practical knowledge what they gave me. So
Right.
within that exam they selected me as a special educator, and I was okay with one-to-one group therapies of 5 to 6 kids, and with all different kind of disabilities: Down syndrome, learning disability,
Mm.
autism, ADHD. I was able to understand and get rapport with them. I just left my son seeing
Mm.
all other kind of disabilities. I was
Yeah.
not concentrating on my son. That was something which I learned from that program. And then, since I had done my bachelor's in science, I moved
Mm.
on for master's. I didn't get a chance to do clinical in my bachelor's, but IGNU was the only institute that
Obvious.
was able to give me a opportunity to learn in
Mm.
psychology. So I just
Right.
went through it, and the things came very clear after I went into Masters of Clinical Psychology. I got the
Mm.
theory. I simultaneously I was doing practical. I got the theory thing also, and everything was going hand in hand. So
Yeah.
that was
So I
something
think what
very, very,
parents
very useful.
and mothers can learn from your this experience is that it's important that we stay motivated. Like Aisha was motivated that I want to do something for my child. I want to make things better, life easier, teach him. And how do I do that? So instead of continuing to cry on the fact that I got a diagnosis and my child is not okay, she started working towards helping the child. That's what we want every mother to be motivated, because mothers can do magic for their
Yeah.
children. They can do magic. They are magicians for their kids. So what I want is mothers as well as fathers, whoever is motivated, even one of you, if get fully motivated to work aggressively at changing the life of your child, at teaching your child, you can also, your energies will get diverted in that direction. Like Aisha trained herself, you can train yourself. If you are already a professional in some other field, you can definitely acquire knowledge about what is right, what can be done, who are the right people who can help your children, and simultaneously general skills, general activities which you can do or perform and repeat with your child at home, what your therapist is doing in the therapy area. And if your therapist is not teaching you, you can always ask them that I want to learn, teach me the activities, and I will go and perform. That will never, should never be an hindrance, because that helps the milestones to be achieved faster, your child to improve faster, and it will ultimately reflect on the outcome of whatever intervention is being done. So I think that's a great thing that you got motivated, and I want all moms and fathers to be motivated and learn and work.
I would like to add on one point. What I experienced was, for fathers, if they divide work, especially for fathers, my message is, they can do play therapy. They are very good in play therapy because mother is always behind the child. They like to play with the father, but the father doesn't know how to interact. That is the
Yeah,
problem where we are going. We are diverting or pressurizing. So if fathers take the role of play therapy and even occupational therapy, since they will be
yeah,
good in that. So if
mm,
though that two therapies, if the fathers work, I think that will do wonders for the child.
yeah. How was your experience? How did your husband, your family support you with
Yeah, my
therapy?
husband actually, once I got to know about his, necessaries, and I need him here, he had to, step back from his work from abroad, and he came back to India just because of his son, which is, I'm very grateful for him to doing that. And he is taking part in all kind of activities for him. I am only a kind of special educator for my son. He is the all rounder, right from the way he
He's
has to
parenting.
feed.
He's doing the
Yeah,
actual
yeah,
parenting.
social skills, occupational therapy, taking him to park,
Mm,
leaving him alone in park to have his sand play and all. He is actually doing sensory integration, but he's unaware of what he is doing. I've just told him, make him play. I've shown him videos, and he's doing it. All kind of sensory integration is done by him, making him swing in the hall with
mm,
a small bed sheet or something hanging. All
right.
those activities I'm making him do, and he's
Mm,
doing it, but he doesn't know that is sensory integration and all those things. So he's
okay.
just following whatever I'm telling, but that's a great help for me as well as my son, because there is
Excellent.
interaction of both the parents who are taking responsibility, and that is something, I'm very lucky enough to say this.
I think that is very important, because both the parents, when they work with the child, forms trust and bond with both the parents, not just the mother. And
Yeah,
sometimes I
exactly.
feel that fathers have a lot more patience than mothers, somehow.
Exactly.
And if they work and do
Yeah.
play, they are far more patient with that. The child will respond, will learn, will do. They are not like, oh, abhi jaldi se kyun nahi aa raha response. Like,
Yeah.
we tend to be like, अभी सिखाया तो आ जाना चाहिए. We
Yeah.
will be a
Yeah.
little less patient. But
Yeah.
I think that's a great learning, that how your husband helped you, and that I think all husbands can do, all fathers can do for their child, because
But
family is
again,
always.
there is a point. K, what I want to say is, there is also positive and negative. When I am very angry with my child, he is the one who controls and gives pampers and things. When he gets angry, I'm the one who pampers. So there is, that balancing
Balance.
thing should be there, which is very important in case of special needs. Obviously, we have frustrations, we have anger as parents, and all those things. We try to put down on special needs, but when there is a coordination between parents, there is
Mm.
escapism, there is maintenance, there is balance for each and everything. I
Yes.
think that should
So
be there for fathers, specifically
fathers.
for, fathers should have that. Okay.
Yeah. So that also tells us that how important it is for the family to support, and it is not just the mother who has the responsibility to take care of the child, but it is the whole family as a unit. When they work towards the goals, then it is a balanced way to do it, and then everyone can give their best. I think
Yeah,
instead of
exactly.
one person doing it and
Blaming, no blame
first.
games.
Yeah, no blame games. Absolutely. No blame games that you didn't do and you didn't do.
Yeah, whatever
Absolutely.
is possible by anybody, they have to do it. That's the
Excellent.
main,
I think
our main motto. Whatever is
main
possible,
one.
we have time, we are doing it. It's not like that's their responsibility, that's their duty. No, whoever
No.
is free, they are going to do it. That's how it
Yes.
works.
That's so beautiful. I think that also increases your bond as husband and wife.
Exactly,
And it
exactly.
increases the functionality of the whole family as a unit. And that's
Yeah,
very beautiful thing. And I think everybody should listen to this part of our conversation, that it is a
exactly.
family which has to, and if you have grandparents and others at home, I think everybody should be brought in for
Yeah, when
accountability.
it comes to grandparents, I have to mention this because initially grandparents had a mindset like, why is she treating like this? When
Mm,
I started giving therapies at home, he was
mm,
screaming, he was, throwing tantrums. Don't do anything to our grandson. Please don't do
mm,
anything, let him be the way he is. That was the statements. And then when they started seeing, observing whatever I was doing and how he started responding and how he was following instructions, now they say, Aisha, you're the best person. See,
mm.
Rehan, I'll call Aisha. So I am
Mm,
the controller, and they themselves are now trained to take care
now
of my son, and
and
they are
trained
taking care
also.
of my
Wow,
son. Yeah, they
very good.
take care
That's
in my
so
absence. They know very well how to handle him, what to do with him, and they are very
very
good in that, because almost everybody, even my small daughter, is trained to take care of him in my absence. I have trained everybody to take
good.
care of him.
I think that's so wonderful that you have the whole family supporting you, and I think
Yeah,
that's a blessing in itself. That
yeah,
having a family
exactly.
support will really help you cope better through the whole process of
Yeah,
intervention.
yeah.
One very important question is that did you ever think of, because we all know that all the intervention, all the therapies, that brings an additional cost when it comes to treatment.
Mm.
There are some special professionals who are involved. There are some additional costs to treating and intervening the child, and there is
Yeah,
always an additional financial burden that we all experience. Not everybody will be able to afford a lot of intervention, or probably the required duration of intervention, because we know in India we have no insurance policies. Have you
yeah,
ever
exactly.
experienced that even for a routine uh, kind of a health issue, that if you require to encash the insurance, you face problem? Because one mother came across me, she said, when I declared that my child has autism, he was
Has
not
autism.
even given hospitalization and insurance
I
for a
need, yeah,
regular
yeah.
hospitalization for diarrhea
Diagnosis.
dehydration,
Yeah,
which was like
exactly.
really very disheartening, that this should not
The
happen at least.
thing happens from medical insurance thing is not even here, it's even in abroad. The moment you say that he has autism, it is
Hmm.
not in the list of medical insurance. Okay.
Okay.
The moment you tell them that disability is there, they will just, the medical insurance people will not even look at the site of like there is any kind of concession or anything. We literally had to pay only for 45 minutes of diagnosis. We
Hmm.
paid around, for one session, I guess, 5000 Indian, 5000 rupees for
Right,
45
right.
minutes.
Hmm.
So that was something, even that,
It is
we
now
had to
even more
multiply
than
it.
that.
Yeah.
In different parts of the country, it's more than that now.
And the most important thing was, they were bombarding us that, since the child is cross this age, this has to be done. Speech therapy for 1 week, okay, three sessions should be there. Occupational therapy, okay, five sessions continuously, it should be there.
Hmm.
Physiotherapy, at least 2 sessions should be there. This is the minimum what we are telling you.
Hmm.
That's the kind of statements we got, and we were like, what? Okay, we started calculating, and we were
Hmm.
like, what will we do?
Do you think if there would be some insurance policy which can maybe partially support, if not completely, and if not the therapy or intervention, maybe other hospital visits or other healthcare facility, some kind of a support will be helpful to the parents if an insurance policy comes which takes care of children with autism or any developmental disability, at least partially, if not completely?
If that happens, half of, I think 50% of the special needs parents will be on, in a queue to get that.
Right,
Seriously,
right.
parents are literally, out
Did
of their
you
reach to.
reach?
you know,
And what
get
do you
those
think? Are
therapies.
you aware about the government policies or the disability certification process? Could you get that for your child? Could you avail any of the facility that the government provides in our
The
country?
first thing I would say is, more than the government, my husband. He said,
Hmm.
people who are deserving, let them get that.
Okay, okay.
We have
That's
enough.
a lot
So
of parents
people
would
who
be
are,
there.
yeah,
Who, here, I would
definitely
want to tell
deserving.
that
Yeah,
having a disability certification can help you, support you a little, maybe knowing
yeah,
about the policies and government policies, and having. I think every child deserves this. Every child has the human right, and every parent has the right to, because everybody is paying tax. You all are
yeah.
professionals. We all are
That's
professionals.
that's what I
So
said to my
don't.
husband. So
Yeah.
initially it was that, but since there was some act of person with disability (PWD) Act of
IPWD,
2016, where
modified
they included 21 disabilities, where autism
disability
spectrum disorder is also mentioned. I
also
went
meant.
into it. I did a research for it, and then I got to know that they, if according to the disability, if the person is having that percentage of disability,
Hmm,
that much amount will be on the in the account of that person, that individual who's
hmm,
having disability. So
hmm.
if the if the kid is if it is a minor, they will be having a joint account with the mother, and it will be transferred to mother, so that
Yeah,
he she can utilize for his education or any kind of therapies or anything. So that much
right.
amount will, for every month, it will be deposited to the account.
Yeah,
So based on the UDID card, what unique disability identity card, what they
yes.
make,
Unique
it depending
identification.
on,
And
yeah,
that can be done, that you can put an online request. They have a website these days. A couple
yeah,
of my parents went and they took that, they got that card made, and they are trying to avail the facilities. I'm keeping them in loop, because if they are
yeah,
able to,
yeah,
then I said you can help more parents, because
yes,
whatever, every parent may not be able to financially afford a
yes,
complete treatment. It's a good gesture on your part to leave that for those who deserve or who are more in need. But for
yeah,
those
exactly,
who are in need, must reach out for it. For those
yes,
who are not having access or have challenge financially, or they must try and at least know. We want to talk about it because we want them to have the knowledge about it, and then
yeah.
choose whether they want to or they don't want to. But
But
know about it.
my
And
point was also that after
yes,
us, what is after us? What will
yeah,
happen? How
yeah,
how will he go and do that card and all those things? How will that happen? We have no
yeah.
idea of when, till when we are
And
alive.
even the
So
government
that's,
services now, they have one
yeah,
person reservation where they are trying to employ also, if some child is having vocational training, on the
yeah,
basis of that card, they are also providing one person reservation for employment in government services. So I think
exactly,
there are a lot of children who can be accommodated. Knowing our rights can help us acquire those. There are Rashtra Bal Swasth Karyakram, RBSK schemes in India. Lot of
yes,
states are implementing them, where other disabilities other than autism are also getting treated in that, and there is a long list of disabilities which is included now. So if the
yes,
parents find out more about it from the professionals, I think they can use some of those services.
yes,
Okay.
exactly.
um, okay, so what we want to know now is, what are the main goals or hope that you have from your child with all the interventions, all the therapies, and all the treatment process? How hopeful you feel, and how good you feel, how you accept everything in your routine life, and how you would want to motivate more parents about it.
So, in case of fixing my mindset, that was the first thing what I did. There is no quick fix. That was
Hmm.
the first statement which I fixed in my mind.
Hmm.
You know,
Good.
you have this cold and fever, you take a medicine and it will be cured. There is nothing like that
Yes.
in autism. There is no quick
Yeah.
fix. That was one statement what I fixed. The next thing what I fix is, I will not force him for anything. He has to
Hmm.
learn it. He will learn it in his own way. I will teach him. but
mm,
there is no terms and conditions. It is unconditional.
mm. Effort as well as the
Effort as
result.
well as, yeah, that thing what I fixed, like whenever I have to tell him, when I make him sit do therapies, he won't respond. But
Mm,
out of nowhere, when I'm working, he comes and says, Mama, mum, 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 mum. He babbles. So when I'm
mm.
telling him speech therapy, he never responds to anything. So
Yeah,
that thing made me think like, okay, his mind is processing when I'm taking the therapies, but it will process little later and things will come out in his own way when he wants it. So
right.
that
But
is something
just
which,
imparting that unconditionally is
yeah,
somewhere
yeah,
layering it up
yeah,
in his brain,
yes,
and then he'll
yes.
eventually come out with those
Yes,
words later.
without even you prompting it. That is
Yeah. So
something which
there,
I've seen
what
in
you're
almost
doing,
all the autistic kids.
yeah, you're not stressing up your child to
Yes.
perform. You're just
Nor
giving
stressing
him
myself, nor stressing him.
him, and that
Yeah,
that reduces their stress of performance, and then they are even more prepared to come out with words. If they are too stressed, then they don't say anything. They tend to
exactly.
become even more mute, or you can say they won't use words at all, even if they know. But if they
Yeah,
are in a playful mood, happy, not stressed up, then they spontaneously tend to use a few words, or they tend
exactly.
to speak more.
Yeah.
So that's a
The
very
other thing
important.
what, yeah, yeah. The other thing what I started doing was writing journal, writing everything, observing every minute thing and
Hmm,
writing it down.
hmm,
So writing it down, in the sense I'm not like a writer sitting down and writing. Just I'll just keep observing him the whole day.
hmm,
Before going to bed or when I have time, when I'm alone, I'll just write few points. Just jot down some points like he did so and so with date,
hmm,
something unique maybe. Recently, he's 7 plus now. He
hmm, hmm,
started blowing. That was something I was shocked to see. So that was
hmm,
the
hmm,
biggest achievement for me since I'm trying from past 2 years. It was not achieved. Out of nowhere, it just reached out. It was like a miracle for me. I just noted down the date and I've just made a video for it. I've stored it somewhere as a sweet memory. That is something which I keep enjoying and I'll keep doing that. It
yeah.
gives me satisfaction, and as well as I look back if something is not happening at that moment, I look back and I see those videos from where he was and where he is now and how things have changed. It gives me more satisfaction, so that thing I keep doing it. So that is
Mm,
something which I think parents should do, since we are always focusing on what they don't do. We have to see other old videos and see what they can do and how far they have come.
yeah. I think that's a beautiful way to self motivate
Yes,
yourself
exactly.
that, okay, you
Yeah,
can get there. See, there was that X
yes,
milestone that we were
yes,
struggling to achieve, but now with all
yes,
our efforts, we could achieve that. So maybe this will also be achieved. Let's keep working. So it's a good reinforcement, I would say. But a lot
yeah.
of parents still tend to lose hope, and
Yeah,
they still
where
sometimes.
things are going wrong is parents have expectations only to that societal status, going to school, studying. They are in that zone where kids should go to normal school only when they have this, okay, this child is fine. Why is that normal school in mind? I don't understand still. So parents should be counseled of, once they get to know that they are autistic, why do we have to think of making them study, making them go to schools and all those things, when the fact is, making them understand time concept, making them understand money concept, making them understand social life skills, basic skills of being an independent self by themselves, and doing things like that can work. But making them go to normal school, pressurizing them, and not getting a positive result from there, and getting a feedback like making themselves depressed, making the child depressed, having
Yes.
all that kind of environment where they are not satisfied, the whole family is not happy. Why? Instead, when you are being that into diagnosis autism, you know what it is. There is no
Mm,
normal word in autism. There won't be any kind of schooling. Okay, to some extent with special education, they can only reach out till they get this SSLC certificate, or they can do. But do you think it is on their own effort what they get? It's just a paper. You know the ability of the child. What do you
mm,
want to do with the child with that certificate? You just want to make him independent. right?
Yeah.
So why do you want to go behind schooling and
And
doing
what everybody
basic
else is
things?
doing.
Yeah,
Right.
basic
What
things,
the
reading his
society is
name, reading things, writing, making his signature is more than enough. Understanding the time for his need, understanding money for his need, that is, I think, more than enough for a special need to learn. That is the biggest thing what a special need can learn,
yes. The
instead of
life
making,
skills, making
yeah,
them independent, helping them learn
yeah,
life skills.
yeah,
These are far
exactly.
more important in
Yes,
real life for them to live through their lives.
yes,
And that is
exactly.
what we should focus at helping
Yeah,
them with social skills, helping them with teaching
yes,
communication skills. So
yes.
these should be our
Taking care
primary,
of themselves, actually.
taking care of themselves
Yeah,
rather than pure academic goals that they should be able
yeah.
to do subtraction, addition. Yes, if they can learn,
Uh-huh.
might as well. But if they cannot learn, we shouldn't be pushing
Leave
them
them.
or
Yeah,
feeling depressed about कि इसको subtraction नहीं
yeah.
आता इसके क्लास के सब बच्चों को आता है. So there
People
we
who
need.
are not having the knowledge of subtraction are living their lives.
Yeah.
People who have not
Absolutely.
gone to school are living their lives.
Yeah. So I
That's
absolutely, but
important. Yeah,
independence and doing things independently and happily,
exactly.
and that's more important. So,
Exactly.
one last message or last question I'll ask you: what would you say to parents who have a really tough time looking at the positive of a child on autism? I know you have said a lot about the positive aspect and how you have always reinforced yourself to keep working, and enjoy every moment of
Yeah.
teaching and his learning. What else would you want mums and dads and other family members hearing our conversation today to take home with them as about the positives of a child with autism or any special needs?
See, the moment you get to know that your child is special need, don't try to focus, or you don't go into meltdown zone or depression zone. The moment you go into depression zone, the child is already back there. The moment you are strong, you have that positive eyes with you, you have that positive affirmations with you, you have that appreciation for every, your child smiles. Wow, you're smiling at me, good job. Wow, what is it? You talk, you become mad, you get lost in the world. I was somewhere down in the beginning when I started my training. I was thinking that I was acting the way he used to act. He was flapping hands, I was also flapping hands. He was unnecessary smiling, even I was unnecessary smiling. The way he used to rotate himself, I also used to rotate myself. The way he used to spin the ball, I also used to spin the ball along with him.
So you engrossed yourself in his play, entered his world, and then you started teaching him what you wanted to,
It should
probably.
happen. It is only from your side. It
Mm,
is not you taking him into your world. You go into his world and see how it works. How it works. Just for a moment, try to, avoid everything and just be with the child for 5 minutes, totally without your phone, without anybody. You spend that 5 minutes, you will be so satisfied, you will be so happy, you will have that positivity with you and the child. You won't think of any a negative thing. The moment you think of the society, the relatives, the in-laws, the parents, everything, that is the negative zone what you're getting. Your child is not negative, he is full of positive. The only thing what you have to go is, instead of bringing him to your world, you go into his world. That is the message what I want to give, and that is what I apply. Sometimes when I'm free, I just sit with him, I look into his eyes, I say, I talk to him whatever I can, as though he's listening to me, and he just smiles and lies down on me. He knows what is my feeling, he can totally understand whatever I'm telling, although he's not speaking. And that
mm,
gives a kind of satisfaction, where he is listening to me even though he's not responding. So that
mm,
kind of bonding should be there, and that kind of positivity that only you can connect as parents, instead of
yeah,
just looking
that's so
at the
spiritual also, I think.
disability. Yeah, yeah,
And
yeah,
I
yeah.
think that's very spiritual state where you disconnect with the world. It's like meditation. You're just being in that moment with your child in their world, trying to be there the way he's seeing, experiencing the world as a mother, as a parent. You're also trying to experience the world with his eyes, his way, and then connecting at that level with the child. I think that's a very beautiful message and a very important thing which parents can try, attempt. I think it's a very
Yeah.
interesting, it will be a very interesting feeling, keeping your phones, your gadgets away, what people think, what the world thinks, and just enter a space where your child lives, and just you and your child. I
Yeah.
think that's the
Exactly.
place where you start creating that bond, and from there, you
Yeah.
prepare your child to be with you. You tell the child that I understand you completely, and
Yeah.
then the child gets
Exactly.
that feeling that whatever my mom is going to tell me or my dad is going to tell me, I'm going to learn it from there.
Yeah.
I think,
Exactly.
Aisha, it was so wonderful talking to you, and it was amazing. I also learned a lot of things because I think it gives a lot of strength as a mother, as a parent, the way you have tackled your own life, the way your family has supported you, the way you
Yeah.
are bringing up your child, and motivating a lot of parents around is a excellent thing. It's a very inspirational thing, and I think good luck to you with all your efforts, and whatever you do, you get a lot of success in helping your child and in spreading a word around and helping so many more mothers with your experience and your expertise also along with your experience. So it was wonderful having you on our live today, and we hope that our mothers enjoyed our conversation and they also learned something and took away some positivity from our conversation today. And
Exactly.
you all can stay tuned in for more live sessions. We'll try and come up with more motivating sessions for parents, and
Exactly.
a lot more Q&A sessions also, which we look forward to. I know there are a lot of questions coming up in the chat box, but we'll surely take up all these questions in our coming session, in the Q&A sessions. So stay tuned in for the channel, and stay connected with us. We will be looking forward to connecting with all of you again. And thank you once again, Aisha, for coming today on our Continua Kids live channel.